Okay, Dr. Vallee, what type of doctor?
I'm a urologist. A urologist is a doctor who deals with problems with the genital urinary tract. The difference between a urologist and a nephrologist is I'm trained in the surgical subspecialty, so we learn how to take care of surgical problems that have to do with the kidney, the bladder, and the prostate, as opposed to a nephrologist, which would deal with medical issues that have to do with those organs, such as if you went on dialysis, that would be a nephrologist. If you had a kidney stone that was blocking, that needed surgery on, that would be a urologist.
Okay. What is your favorite part of your job?
Favorite part is helping people. When a patient comes in with a problem that really only myself or someone else in my specialty can help them with, that's very satisfying and fulfilling, and it helps you with all those years of hard work and training that you did. Now you can have a tangible way to help someone with that, and that's very fulfilling and satisfying for me. And most patients this day and age still very much appreciate what you're able to do for them.
Do you feel like there's a least favorite part of your job?
The least favorite part in the modern age of medicine would have to be dealing with the bureaucracy of medicine. You know, if you look back 50 years, you, your father, or a relative would call you in the middle of the night, you would get up, you would go take care of them and do whatever needed to be done. This day and age, if you want to take care of someone and do what needs to be done, you have to go through a whole series of steps that have really nothing to do with the practice of medicine and helping people. It has to do with filling out the paperwork in the proper form, going through some government bureaucracy, or dealing with someone who really doesn't understand medicine too well. So jumping those hurdles that make it more difficult for you to practice medicine and what you're trained to do is probably the most challenging part of my job now.
If you could go back to college and change your major, would you, and why?
It's difficult to say. I enjoyed my major, which was biology, which really helps prepare you for medical school. But I think another way of doing it would go into something that really interests you. For example, political science or economics, or a field that really doesn't have much to do with medicine. It would make you a more well-rounded person and help you interact with patients on a different level later on. So if I were to go back and do it, I think I may change my major to something in the humanities, which I also have a passion and a love for, and at the same time get my prerequisites to get into medical school and still do what I'm doing today.
What made you want to become a urologist instead of another doctor?
Well, there's many reasons. I really loved surgery, and when you first go through medical school, you come out or at least you go through the medical school, and there's a path you have to take, and it breaks off pretty early on. Either you want to go in the medicine route, or you want to go in the surgical route. So right away I knew that I wanted to do something in the surgical field. I really love surgery. It was very interesting for me. And I didn't really want to do general surgery, because there's a lot of issues with general surgery. I found that those people doing it weren't necessarily the happiest people. They seemed to be not really enjoying their work so much. And when I got to urology, without knowing a lot about it, the people that were doing it seemed to love what they were doing. They enjoyed the process. They enjoyed the surgery. They did everything the general surgeons did. They seemed to enjoy it more. So that kind of is what attracted me to it initially.
Would you say it is easy to find jobs as a doctor in your field?
Yes.
And what about in any field?
In medicine, per se? I think being a doctor this day and age, you can still, if you're a decent doctor, do an okay job, you can get a job just about any field of medicine. That's one of the things that attracted me to medicine, going back to your earlier question, is the security of being able to have a job, not only helping people, but knowing that you can get work, and you can support yourself and do those type of things in such a way that you're helping people throughout your entire life. So there's few fields where you can really say that you're doing that. If you go into sales or business or other types of fields in life, you don't get that benefit. I felt like I could always get a job, I could always work, and I can do it in such a way that I'm helping others at the same time. And it's also challenging. It's forever interesting to be a doctor, is that you have to keep up with the latest things and what's going on. It stimulates the mind. You can't become complacent and passive with it, or you fall behind and you don't do the job that you should be doing with it. So I think you can get a job in medicine, pretty much in just about any field of medicine, and I think it's a great field to go into for for that reason, and it's because you can help people while you're doing it.
Mm-hmm. How many years were you in college for?
I started off in physical therapy, actually, and I did 2 years and got a pre-degree in physical therapy, and then I worked my way through, but really, so that made me 5 years in undergrad, and then I went on to medical school, which is 4 years medical school. And technically, your schooling stops then, but your training doesn't stop. After medical school, you go on to residency. And residency can be anywhere from 3 years up to 6 years. Mine, or 7 years if you go count neurosurgery. Mine was a 6-year residency. So if you add all that up, it was 5, 4, that's 9. Then you had the 6 years afterwards, so it was 15 years that I was in training.
Do you ever feel like residency was really stressful, or you just wanted to, like, I don't know, take a nap for a week?
Well, residency was extremely, it's like the quote from Dickinson, is the best of times, it was the worst of times.
Mm-hmm.
It was the best of times because you're with the most intelligent, motivated people you could ever hope for. You're with them day in, day out. They're constantly stimulating, dealing with the most complex of problems, and having literally people's lives in your hands. So you're in that situation where it's extremely stressful, but on the other hand, it's very satisfying and fulfilling, and it drives you. So at the time, I didn't necessarily notice the stress. I was just in the process, in the moment, doing it. So it was stressful, but on the other hand, it was great.
About how many surgeries do you perform a month?
Well, I do a lot of surgeries a month. There's procedures, there's minimal procedures, and there's major surgeries. But if you look at like scopes where I look in people's bladders, and you do things like remove their prostate, or remove their kidney, or remove their bladder, or a whole series of different procedures, probably close to 50 or 60.
That's interesting. Thank you for the review.
Thank you for interviewing me. I appreciate it.